on my gloves, and I introduce myself. I'm Margaret Johnston, and you're Tammy, and I'm going to do your exam. Now, I'm going to do a lot of additional talking that I don't need you to tell me when you do your exams. That's just by way of explanation. So I just start the exam. Okay, I'll do your head exam. Now, the hair is fully distributed, and I don't feel any lumps or bumps. Any tenderness? No. Okay, great. Now the hair is medium textured, blonde hair. It's wavy, and that's about what I have to say about it. Okay, so now I've got to go to the temporal arteries. So she has +2 out of 4 temporal arteries. And notice that I put in the face on your practical. The nurse practitioners are going to be asked to do the same thing. So first of all, I'm going to do facial nerve 7. So smile for me. Good. Now, clench your jaw. So cranial nerve 5 motor is intact because the jaw is of equal bilateral strength. Now, side to side. Now, there is no crepitus. Now, does anybody see what I'm missing? Cranial nerve 5 sensory. Good for you. I did that on purpose. Very good. Okay, that would go right there, wouldn't it? Okay. Sharp. Soft.
Okay.
Now, shut your eyes and tell me what you feel.
Soft left cheek. Hard right forehead. Soft right cheek. Hard left forehead. I think soft lower left
Okay,
jaw.
good. So cranial nerve 5 is intact. She's able to differentiate between sharp and soft, or dull, if you will. Okay, so now I am going to do the rest of the face. I'm going to do the sinuses now. This is an option. Now, any tenderness?
No.
Sorry. Okay, great.
Feels good.
Yes. Now I'm going to be doing my lymph glands.
Okay.
So, submental, submandibular, jugulo-digastric, preauricular, postauricular, occipital.
Oh, sorry.
Oh, that's okay. Very good. Now, superficial, cervical. Now, deep cervical. See how I do that? Great. Now, posterior cervical chain. Punch your shoulders a little bit. Oh, wow, not that much. Okay, now that's supraclavicular and then infraclavicular. So no lymphadenopathy.
I usually have a node that's a little bit prominent.
But it's under a centimeter and it's mobile.
Okay.
Yeah, it'll pass.
No, I've had it for years.
Okay, well, we'll just,
Okay.
all
All right.
well, napalm it or something. Okay.
Right.
All right, now what I'm going to do now is I'm going to do the eyes. I'm going to start from outside in. I'm going to get my little chart here. Now, the eyebrows and eyelashes are symmetrically distributed. There's no ectropion or entropion. Now, the sclera is white, the iris is brown. Now, look up. The palpebral mucosa is pinkish red. The bulbar mucosa is clear. Now, the patient can help me. Will you hand me that ophthalmoscope over there? Thank you very much. Smart patient. Thank you so much.
Bought a set.
Great. Yes, you are going to need your set. Oh, let me look at my eye. Never mind. Okay, so what I'm going to do is look at the cornea from the side now. Okay, so the cornea is clear. I don't see any abrasions. That's good. Now, coming around from the side. Okay, now, she actually is pearl. Pupils wrinkle round and reactive to light. So that's as far as I can go. Now it's time for the eye test. So we're going to hold on to that. Did you look up at the light? Okay, so the corneal reflex, or Hirschberg, is symmetrical, and it's at 11 o'clock. Now what I want you to do is I'm going to have you cover your eye like that.
Okay.
Okay. Now look at my finger out here. Now remove the cover. Okay, so there is no eye movement, so there's no tropia, no phoria, no fixed or non-fixed strabismus. Now, one side is good. If you can do it on one side, you can do it on the other.
Okay.
Most people can. Okay. Now, this is the old-fashioned H for EOMs. Okay, so you can follow my fingers. Up, 3 superior, 3 inferior, right 6, 3 medial. Okay, 3 superior, 3 inferior, 3 medial, left 6. Now, this is the all 3 for 1. Okay, so the pupils are getting smaller, the eyes are converging and accommodating. Okay.
Were they?
So she converges, she accommodates, and cranial nerve 4 is intact.
So I can't do cross-eyed, so I would.
So you did fine, just fine. Now, you can choose to do it the way the book teaches it, if you can tell me what nerves you're testing. Now, just look at me and tell me when you can see my fingers.
No.
Okay. Now, this is,
No.
okay.
No.
Now, that was peripheral fields. There's another way of doing it, and that is a little bit more precise in my book. So cover your left eye. Now, when you see my fingers, let me know.
No.
Superior 50,
No.
medial 60, inferior 70, and peripherally
No.
90. Okay, so it's 50, 60, 70, and 90. Now, another way to do the EOMs is to just have the person follow the finger and do both eyes at once. So when the eyes move in this direction, that is inferior 3 to the right and left. Now, when I move up in this direction, it's superior 3, right? Now, inferior 3, but it also is getting right 4 because of the nasal movement. Okay, now that is superior 3, 6 and 3 medial, 6 and 3 medial, and that's it, right? 6 cardinal gazes. But you have to be able to tell me what you're testing. So I don't care which one you do, but you have to be able to tell me what you're doing, okay? So whatever works. Well, could you hold this card at, and do you have your contacts in?
I don't wear contacts.
Oh,
but I do
well,
have glasses.
perfect, perfect. Now, if you will cover up your left eye and read the smallest line you can, I'd really appreciate it.
Oh, jeez.
That's the
Do I
second to
squint?
last line, isn't it? Good for you.
I can't, no. 6-3-8, E, like a E and upside down E, and then an E to the left, X is 0, 0. I might be able to go 1 line lower.
Are you here?
No, I was
Down.
there.
Oh,
I don't have the greatest vision.
okay. Why don't you try to read here?
Here?
Yeah.
Okay, I'll try. I don't know if it's an 8 or a 6.
Okay, so let's go to the line above.
Okay, 8, 7, 4, 5, left E, down E, up E,
Okay.
XO.
20 out of 70, so interpret that for the client. Okay, you're seeing what most people can see at 70 feet, and you would see it at 20. I'd like to make a referral.
I have to get new glasses. I already went to the
Yeah.
eye doctor.
Do you want to try mine on? Okay, for mine. And I can get rid of them. Okay, so we went through all the eye tests, correct? Yeah, that went fast. Now we're going to do the ophthalmic exam. Okay, so first of all, I want to get a big picture. Now, I am not going to turn the lights out because I want you to see what I'm doing. Take off your glasses. Have the person look at some object. Do darken the room for me. And then I know which way. Okay, now I'm going to go in. Oh, nice. Okay, so she has a reddish pink background. Her arteries to veins would be 2 to 3, and her cup to disc ratio is 1 to 2. Now you will start to see more stuff than you would anticipate as you practice. Now do you see how I'm using my thumb here as a way to guide myself? Actually, the findings on this eye are exactly the same. Really nice. keep those eyes. You may need glasses, but I like those retina backgrounds.
Okay, thank you.
Oh, as long as I'm here, look, why don't you hold on to this for me? Good. Yeah. All right. Now, the ears are inserted at 10 degrees. They're elliptical. I don't see any obvious tophi, and no palpatory tenderness. Mastoid process is fine. Could you hand me that first comb? Thank you. Good. Now, I'm going to come to this side, and what we'll do is left hand, left ear, and I want you to do the left eye and left ear for me. Okay, now, tympanic membranes at 7, the malleus is at 10, the posterior quads are a little bit opaque, which is fine. And I also see some fun air bubbles and a little effusion. Never mind.
What does that mean?
It'll
I'm
be
going
fine.
deaf.
There we go. Yeah. Now, could you push the tragus in and out on the
sure.
right side? I'm going to get behind you.
4th of July.
Okay, so able to perceive the whispered word at 2 to 3 feet. Okay, great. Now we've done the face, so now I'm going to be thinking about the nose. So I still have my gloves on, and now the nose is symmetrical. Do you mind obstructing when I breathe through that side, not the other? Any problems?
That was a little stuffy, but not
Okay.
too bad.
Well, that explains the nose and the ears. Now on this side, I actually can see the turbinates. And do you use like Claritin or something?
Claritin? No.
Or some type of antihistamine?
No.
Okay.
Not like
Her membranes are a little bit a little bit pinkish blue. They're not as red as we would expect. And Kiesel box capillary beds are present on both sides. So that's the nose. Okay, mouth. Now the lips are symmetrical. The vermilion border is sharp. Now can you open up? Okay, good. Now I always start with the mucosa. Now I don't see any patches or hyperpigmentation. The mucosa is all pinkish red. Okay, now the gums are well adhered to the teeth. 1, 2, 3. Did you have wisdom tooth extractions?
I
No,
never
you've got a
had
full
them.
set.
I never had wisdom
Yeah,
teeth.
you have a full set minus the wisdom teeth. Okay, 1, 2, 3, 4, yeah. Okay, now the hard palate, soft palate are intact. Now stick your tongue out. Okay, now say ah. Okay, so 9 and 10 work.
Sorry, I haven't brushed my teeth since like
Oh no,
6:30
don't
this
worry.
morning.
Don't worry, I have coffee. No one's gonna look in my mouth. Okay, so 9 and 10 are intact because the uvula rises and it's midline. Now let me look at those tonsils. Ah, good, 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 good job. Now you don't seem to have any tonsils. They were removed. Yeah, no little actors. And the posterior pharynx is pink, so that's great. All right, now let's do